Right, let's get some analysis now on the big issues of the day. We'll start with the insistence from the Federal Health Minister today. The nation's hospitals must admit coronavirus infected patients who require clinical care regardless of their age. His comments follow reports elderly victims were being turned away from hospitals. Joining me now, the Australian's political editor, Dennis Shanahan from Canberra. Dennis, I'm really keen on your views here. What we're seeing in Victoria, and again, it's specific to Victoria, but we've got aged care residents needing hospital beds and the hospital system run by the state government more inclined to want to treat them in the facilities, not the hospital. Greg Hunt has had to say again today that age should not be a reason to discriminate. I mean, these people, they have paid taxes all their lives. Surely, if they need a hospital bed, they should get it.
Well, precisely, Peter, and Greg Hunt has made the point more generally today. But I've actually seen an email very early in the problems, as problems emerged from the aged care crisis, from an aged care operator appealing to the federal health authorities to intervene to allow an aged care resident who was diagnosed with COVID-19 to be allowed into hospital, and that on several occasions, several patients were turned away from hospitals or had their admission delayed because the state hospitals simply didn't want to take them. And as you say, the aged care hospitals, aged care residences are not equipped for dealing with a virus of this strength, and it is necessary for the hospital systems to allow the residents to go into hospital. We saw this in New South Wales. Even Anthony Albanese has been making the point that this is something that needs to be done. Bill Shorten has made the point that we need to shift people out of nursing homes and into hospital if they have COVID-19. It's the only way to deal with it. And I think that there's been a shortcoming here from the Victorian hospitals.
It's been repeated, though, on and on and on again throughout this crisis. We saw in New South Wales, Dennis, at the Dorothy Henderson Lodge, 6 deaths there, but 80% of residents were transferred to hospital. Newmarch in New South Wales, most were cared inside the facility and 19 dead. So we know if we get our elderly to hospital earlier rather than later, they're more likely to survive. What's the issue? Because in press conference after press conference last week, the Victorian Premier tried to make this the fault of the federal government, but he's the blocker at the bed level inside hospitals because he, the state of Victoria, run the public hospital system.
Well, I think what you were saying earlier is right, Peter. There's obviously an attempt to try and shift the blame here. Victoria is in deep trouble. As everyone points out, all the other states have had outbreaks. Some of them have had bad outbreaks in aged care homes, and yet they managed in the end to get over them. And now Victoria is the one with the rampant cases. We hope the curve is flattening, but of course, with the time lag, the deaths will continue. But I think that the issue here is that there is an attempt to try and make aged care, as federal Labor has made, and asked legitimate questions about the federal government's role in aged care. But the point is, the aged care has to deal with something that they can only be dealt with in hospital. The experience in New South Wales is that it is better for those vulnerable people who are in aged care to go to hospital and be treated there. There is a lower death rate, simple as that. And I think that's where there's a blame shifting going on.
Oh, clearly it is. We'll stay right across that issue, obviously. But let's move on to some economic issues. Experts say we're in the very early stages of a prolonged recession, but some retailers are reporting a boom in sales. The CEO of furniture chain Nick Scali says consumers are buying household goods with money set aside for holidays. Now, I know that's what he thinks the money was set aside for, but I'm concerned a bit here, Dennis. I mean, look at those orders were reported today in the May and June, July period, up 70% at Scali Furniture. A lot of Australians are on JobKeeper. Many are on the double dole. Is this where the money's going out of those payments and not perhaps being put aside come the winding down of this welfare in a couple of months' time. Are there concerns about how hard people will be hit in coming months, or do you think we haven't realised how bad things are?
Well, I think there's a couple of different subsets here in the spending. As far as the Nick Scali and the upmarket furniture purchases are concerned, they're unlikely to be people who are on JobKeeper and JobSeeker. They are people who have had higher incomes. They are redoing their houses and their homes where they're locked in. So these are much larger discretionary spending. And so these are unlikely to be people on JobKeeper and JobSeeker. 70% increase on 12 months ago on furniture sales is extraordinary, but it is still high-end, high spending. I think that the difficulty for the JobKeepers and JobSeeker recipients is that they're more likely to be spending money on lower-cost consumables and not the big items. So I think to a degree, the argument that a lot of the money in the furniture sales is coming from money that isn't being spent on a trip to Europe or the South Pacific or on a cruise is probably correct. But I think also there is going to come a time when JobSeeker winds down, has to be wound down, when JobKeeper is also wound down, and that's when we'll start to see a real drop in sales and a real effect in people who don't have jobs.
Yeah, of course, we can't forget if you're under the age of 45, you've got no real memory of the previous recession. So for many Australians, this will be their first experience and they may not understand what's about to hit in a big way. One of the nation's biggest employers, Wesfarmers, is urging National Cabinet to prioritise tax reform. CEO Rob Scott says it should sound alarm bells that for the first time since the 1970s, more funds were being invested offshore than overseas investors were pumping into Australia. He says this is one of the key reasons for the slowing jobs growth and falling investments. This is the tax issue. But I read that, Dennis, and I thought to myself, what about all the billions that our super funds hold? You know, what can be done to get more of that investment into Australia? Are we going to have a fair income tax and investment debate ahead of the budget?
Well, I think we'll probably still be concentrating on the here and now and the immediate threat from COVID on the economy. What you're saying is we do have to have a debate here, a big debate on the economy, on tax and investment. And one thing to remember, the recovery from the global financial crisis was backed by the fact that there was large investment from China. Now, that investment's not there, and as Scott has pointed out, the investment is dropped away. It's been dropping away for quite a while, and this is bad for Australia's future and job creation. The question is, are we actually going to have such a fundamental debate forced on us by COVID, or are we actually only going to look at the smaller bits about, early access to superannuation and so forth, rather than the big picture debate, which is what people are calling for? Can COVID actually prompt us into the really big necessary changes?
Well, I wrote about this on the weekend. I wrote about water and energy, and obviously, the Wesfarmers comments today about structural tax reform. Inside Labor, it looks to be more and more that there's a revolt against Anthony Albanese's stated position on energy. We've had Bill Shorten now into the fray, siding with other MPs, Joel Fitzgibbon, who we know about, Matt Keogh, and the left's Kim Carr, declaring that gas and lower energy prices are critical to protect and, in fact, reboot manufacturing. Now, is this a fair income shift of policy emphasis here, or is this posturing, do you think, ahead of the state election in Queensland in October and WA next year, Dennis?
Well, look, I think there's obviously a deal of state election-driven dynamics in this in Queensland and Western Australia, both big resources states and both big gas producers, Western Australia particularly. So what we've actually got to see here is that in that context. However, I think that there is a real debate going on within the Labor Party. I think it's too simplistic to actually say, oh, well, it's Bill Shorten or Joel Fitzgibbon trying to run for leader. I think that there is a real debate within the Labor Party, And so far, we've now seen the national conference being put off till next year. And so what we're actually going to see is this debate is going to go on for quite some time, and it's about workers and coal miners in the Hunter Valley, where Joel Fitzgibbon is. It's about gas workers that Bill Shorten has represented in the past, and it's about trying to ensure that gas is not dumped. I mean, gas was seen as the halfway house between renewables and coal. Now we're actually getting to the stage where everyone wants us to jump gas, forget about gas, go straight to renewables, 100% renewables. It's not feasible. Gas and coal are going to be a large part of the energy mix for a long time. And I think that what we're actually seeing in the Labor Party now is a debate that has to be had, and it is a policy debate. It's got a lot of politics with it, but there is this real debate within the Labor Party over 100% renewables versus gas as a transition. It's not about not moving to renewables. It's about using gas as a reasonable transition to a lower carbon energy policy.